Greetings. We welcome you to another one of our patient education videos. My name is Dr. Jacob Curtis. I'm a physician at Grand Peaks Medical. I practice in the realm of family medicine with an emphasis in obstetrics, and I also serve as the medical director at our organization. We're excited to share with you in this patient education video some tips and tricks that can help to improve your sleep. As you can see from my slides, my cover, this is taken from my high school days when Bon Jovi came out with an album called I'll Sleep When I'm Dead. It's a popular expression many of us are perhaps guilty of using, and we've likely heard throughout our lives. Oftentimes, unfortunately, we falsely believe this. The purpose of the few moments we have together is to review why sleep is so important and some things that we can do to help us to improve in our sleep hygiene. The disclaimer is that this is not to take place of advice given to you by your healthcare provider. If you're having emergent or concerning symptoms, you're instructed to follow up with them and or go to the emergency room. Benjamin Franklin perhaps said it best nearly 300 years ago when he coined the phrase, which is popular still today, early to bed, early to rise, makes a man healthy, wealthy, and wise. Little did Mr. Franklin know nearly 300 years ago all the scientific data that would support his claim. The challenge is most of us as Americans do not have great success in achieving what he encouraged us to do. There are a lot of complications of insomnia or inadequate rest. This slide just outlines a few. It can decrease our performance in whatever activities might be. It also delays our reaction time. There have been several studies that show that 24 hours of sleep deprivation is comparable to being legally intoxicated. It also can increase our risk of getting colds and other viruses, and it can compromise our immune system. It also increases our risk for certain mood disorders and other factors that can affect our mental health, such as depression and anxiety. It also can increase other comorbidities or other complications, such as increase our risk of obesity. That can be due to metabolic changes that occur within our body, but also I know for a fact myself, when I'm exceptionally sleep deprived, I'm more likely to eat things that I might not otherwise in higher quantities. And that can secondarily lead to high blood pressure, diabetes, and other disorders, including heart disease. This is a busy slide that reminds us of different tragedies and accidents that have occurred over the last 50 years. In every single one of these cases, sleep deprivation was at the root cause. The top left reminds us that of the hundreds of American lives lost each day in car accidents, oftentimes inadequate rest is a common factor that can play a role with why those accidents occur. The top right is a reminder of the Chernobyl accident. As they studied that, they realized that sleep deprivation was at the root cause of a mistake that was made. The middle slides remind us of something some of us experienced in the 80s when the Challenger shuttle exploded into space. The bottom left, the Exxon Valdez oil spill, was also a result of sleep deprivation. And so the consequences can be large and small. The point is, it's so important for us to get adequate rest to be our best. Why is it so important? During those moments of 6 to 8 hours, hopefully on the latter end, there's so much restructuring, modeling, much like shutting our computer off at night and allowing it to rest. It's actually, or getting updates, our body is doing a similar thing. It helps us to heal and to regenerate things that have otherwise been damaged and injured in the course of our daily activities. So this slide reminds us of some things that we can and should do to help to improve our sleep. First, it's important to create a bedroom environment that's relaxing, oftentimes making it colder than what we might be accustomed to. When our body temperature is warmer, it's hard to get adequate rest in most cases. The second bullet point is so huge in 2020, and that is we're just too plugged in. We're using our electronic devices too much and for too long. One of the worst things that we can do to really disrupt our circadian rhythm is using electronic devices in our bed. Many of us use our phones guiltily, watching TV, computers open. Especially if we're having challenges and difficulties falling asleep, staying asleep, we really need, that's a high yield activity that we can engage in that can make a profound difference. Many studies have shown that if you turn it off an hour before bed, that's going to help your body to wind down more effectively. So no electronics in bed, and even try to avoid those an hour prior. Having a regular sleep and wake cycle can also be helpful. We know this, those of us who are parents and have raised children or are raising children, it's so important to have that regular routine. We need it as adults as well. Another huge area of guilt for many of us that we have opportunities for improvement is our caffeine consumption. Caffeine is it's what's referred to as a methylxanthine, also known as a diuretic. It's not just the stimulant effects that can stay in our body 6 to 8 hours after consumption, but as many of us know who consume caffeine, it can act as a diuretic and cause you to have to get up in the night to use the restroom more often than you otherwise would. Is a reiteration from the bullet point on electronics, really trying to use our bed only for sleep. For those who are students, not doing homework in bed, not studying things that'll stimulate our brain. Our brain is so incredibly amazing, and it gets confused if we try to encourage it to stay alert in the same setting that we then encourage it to fall asleep. And so try to separate those activities as far as the location. Keep pets, and I might also add young children off your bed. I know that sometimes those of us in child raising, especially when our children are small, it can become the family bed, but that can really disrupt us and them. And so really trying to work through those routines. Another strategy that's helped many who have a difficult time falling asleep is wearing sleep clothing. What is referred by this is oftentimes people and their motivation to have better health might say, I'm going to hit the gym tomorrow, and to prepare me for that, I'm going to wear my gym clothes tonight. That can really mess us up as well. And so having something that your body knows that when you put on shorts, nightgown, if you're so inclined, that it's going to help us to be classically conditioned to fall asleep more effectively. Other bedtime ritual factors that can help us, for some, a hot bath, finding and reading a book, warm milk or a chamomile tea. And lastly, for those who have an exceptionally busy mind and just can't quite shut it off, writing those things down can help you have some element of closure. For some, prayer, reflection, meditation can also help with that. Like this slide, it's a little bit of obviously somewhat comedic, but also true. I don't want to sleep like a baby. I just want to sleep like my husband. I think my wife could attest that the truth of that in our household. For children, the tips are similar. Again, bedtime rituals. Enough time to sleep is a reminder of the ages of our children or grandchildren and how much sleep their body really requires. Again, having the regular sleep and awake times. Systematic ignoring. I think I deliver a fair number of babies and take care of those babies in the office. And I see a lot of young first-time moms who feel guilty about allowing their baby to cry to sleep, worried that they're going to cause some type of repressed negative emotions as they get older. It's just not true. If our child is fed, if they're changed, it's okay to let them cry for a period of time. If it goes on for a long time, give them a brief hug, but let them getting back to that systematic ignoring. I know it's tough to do. There might be some tears and some hand-holding with your spouse to get through that, but it really can help to train them and us. Positive reinforcement for the good behaviors, especially that toddler who's trying to learn how to sleep in their big girl or big boy bed, and encourage them to stick or chart or other things as they have positive experiences and success, even in smaller areas. Sleeping in their own beds is another reiterated point. White noise, we're a huge fan of white noise in my house, kind of drown out some of the other sounds that might otherwise disrupt them. And night lights for children. It's interesting, night lights can be helpful for kids, but less so for adults. The question is, when is it necessary to see your healthcare provider? It might be best answered if you're still having a difficult time falling asleep within 30 minutes or staying asleep throughout the night after incorporating these sleep hygiene measures. For some individuals, they might be suffering from some elements of chronic pain that's prohibiting them from falling asleep. I'd encourage following up with your healthcare provider to address that. Others, they might have a really difficult time turning off their mind. There might be some less well-controlled symptoms of anxiety and or depression. I encourage you to talk to your healthcare provider about that. For others, there might be excessive nighttime urination. Again, there might be metabolic or underlying endocrine or other medical disorders that can be corrected and adjusted. So I guess putting a plug for following up with your healthcare provider. Thank you for joining us for this brief educational video. We hope that you're able to incorporate these principles to have improved sleep, to improve your health and those around you. Thank you.